And you're live, Dr. Emer.
Hey guys, it's Dr. Emer. We're on another patient today for male facial sculpting. I'm really excited about this patient because he has a really great definition to his jawline, cheeks, and chin already. And all we're gonna do is little tweaks to just keep him from one, looking like he's aging at all, and two, keeping that really chiseled look. He's very muscular and athletic, so we like to balance that out because remember I talk about this all the time. Men that exercise lose a lot of facial volume and their contours start to disappear, especially in their 20s to 30s. So before you start getting those under eye hollows or some sagging in the jowl area or a recessed chin because the mouth starts to recede as you age, we can use fillers to keep those areas plump and lifted without looking overdone. So we're gonna take my client here today who already has a really chiseled look, and my goal with him is to just do a little bit of lifting for cheek and a little bit of balancing in the chin, and it'll be great. And what we're gonna do is we're gonna use a filler called Voluma, and the reason I like that one is because it lasts in guys that are more muscular, also who are more athletic. So what we're gonna do with him, different than other cases before, he's got a much wider jawline, so we can go a lot wider with his chin. And that's actually gonna give a really nice contour there, and you don't really need to use a lot to see the benefits of it. But we're gonna go all the way down onto the bone. And then as we move laterally, we're gonna shift over to a more superficial position. And really just build out what we call this lower cutaneous lip area. This will give him a lot more lateral definition. It's actually part of the area that doctors shave when they do a chin implant. They taper it out this way. And I want him to look like he has a nice tapered look. So we're gonna work on that lower cutaneous lip after we've done some projection already in the chin. We've done projection in the midline and laterally. And then we're gonna work to balance this cutaneous lip again, right along this marionette area.
Can you get filler for your chin if you have jawline if you have chin implants?
You can do it if you have jawline implants or chin implants. Just has to be placed in the proper position. So you definitely want to tell your physician if you're gonna do that. And that's our first syringe, which is great. I think that's perfect for this area here. You don't want to go too aggressive. I'm gonna let that sit a second while we build the cheek. Now here's the thing with men in the cheek. You don't want to overdo it. And in someone like him, very different than what we injected before, who had a more long face and wanted something more horizontal. Here we want to focus on a superficial location, and you don't want to make it look very done. So this will help not only his under eye area, but also give that little bit of like a squared off look to his face. So we're gonna go right down to bone in what some people call the deep medial fat pad or the inferior ocular fat pads. And we're just gonna build this up on an angle, just a slight bit right on the bone. And you guys will see what I'm talking about when we do it. Coming up on an angle. Totally different injection technique than what I just did in the other room. Some people call this a pillar approach. Great, so this is an approach that nobody will know he did anything. Let me see, oh yeah, that's good. And again, angled, more superior to location. He's doing great. And again, using Voluma to give a lot of lift, to give support for long term because it lasts much longer. And also this area will also help support his under eye. This area right here always has little blood vessels, so that's why I'm holding pressure. Called the superficial transverse facial vein. That vein always somehow gets hit in men on the lateral, upper lateral portion of the cheek. So I always like to hold a little bit of pressure there on both sides. I think that's great. So I'm going to show him real quick. You did really good even with a number of pokes. So come wipe them off. Let's do an Emer reveal. Show him first on the phone because I want to see what he thinks on the phone, and then I want to show you You have it? Hold down really quickly and take a look on the actual phone itself with the light. I'm gonna show you what I did. And then I'm gonna give you, grab it. So project this a little bit and widen it slightly. And then if you look to the side, turn this way, just a little bit of height on both sides because it will balance this. And again, we don't want to do too much on the cheek. Will you hold the pressure on the other side? Oh yeah, that's really good. So you can see it in the light. And then a little more lifting here. So you see in the light how it's more lifted. Now obviously this will kind of go down a little bit, not look as big. Once that settles in, it will lift not only this area up too, but will balance out how chiseled you are. So now you have more of that line here that guys like to look more defined. And then also if you look, turn to the side just slightly, look at the projection of the chin, and we kept the width. So that balances the widening here, and the lifting there. So now I would show him in the mirror, because I want to see this. It looks a little different without the lighting and stuff. Here, take a look. So now when you're gonna look at yourself every day, what do you think?
I'm ready to conquer the world.
Exactly. Yeah, I mean it's amazing. So what I like about this is I almost call this like model filler because it's so subtle, but it enhances the features. So you see, look at his feature enhancement. Such a subtle amount, making a huge impact. Global facial rejuvenation and sculpting, using couple voluma to build out the cheek and the chin. Thanks, guys.
But honestly, it looks so
really
awesome.
good,
I'm
isn't
super
it?
stoked. I'm super happy.
Great.